After the recent opioid crisis that hit Middle Georgia nearly 1 month ago, state officials are still working to find answers. They continue to break down the components of the deadly synthetic opioids, including fentanyl, found in these yellow counterfeit pills branded as Percocet. These drugs were found on our streets. GBI spokesperson Nellie Miles says recent test results revealed something authorities have not seen before.
They were able to confirm 2 different synthetic opioids in one tablet. And what that essentially means is that there was a drug called U47700, which is also known as pink, on the street. Just alone is highly dangerous. And then there was another drug that the GBI crime lab had never seen before. It was a brand new fentanyl analog. And what that means is that it's related to fentanyl. The best way to look at it is that it could be a fentanyl derivative or fentanyl-like. And that name of that was called cyclopropylfentanyl.
Similar to national trends, deaths related to opioid overdoses continue to rise across the state. According to the State Substance Abuse Research Alliance, Georgia ranks among the top 11 states with the most prescription opioid deaths, totaling more than 1,300 each year. Local law enforcement gets trained on how to handle the drugs, but beyond the streets, state prosecutors face an even tougher challenge of trying to track down the suppliers.
Users don't want to tell where they got their drugs, whether that's to protect themselves or just so that they can maintain their supply. If a person is an addict, they want to be able to still have access to that drug later. And if they testify or come forward and give information to law enforcement, then they won't have access to those drugs in the future.
Many of those overdose victims are rescued by the well-known drug naloxone, which reverses opioid overdoses and virtually brings victims back to life. However, Miles says the street-made synthetic opioids are getting stronger.
What we're seeing is that the drugs that they're making are getting stronger and stronger, and it's taking more and more to reverse the effects. We have heard in other states and even overseas where there are drugs that are being made that are so strong where naloxone does not do it. It does not reverse the effects.
The state of Georgia is doing its part to help those who may be addicted. In April of 2014, Georgia House Bill 965 was signed into law. Also known as the 911 Medical Amnesty Law, it provides protection from arrest and prosecution for people who call 911 seeking help for drug-related overdoses. Ultimately, that means neither the caller nor the victim can be arrested, charged, or prosecuted for small amounts of drugs if the evidence gathered at the scene is a result of seeking medical help. In Bibb County, there's a unique program known as Drug Court, the state's very first program of its kind, created in an effort to help people overcome addiction through the court system.
So the idea is to help people overcome what's not just a criminal justice problem, but a public health problem, to help them overcome a disease so that they can be a productive member of society.
GBI says while street-grade opioids continue to be a trend among users, the state of Georgia is already ahead of the game.
What is so great about this story, though, is that Georgia is very proactive with this legislation, and in April, the governor signed a law that already outlawed this new drug before it even came here, based on an analog statute that's part of the Georgia law.
Tavares Jones, WGXA News.